It can identify the abnormalities in a person's posture, which is crucial for developing effective rehabilitation plans. We're honored to have with us today a distinguished expert in this field, the director of NPR International School and a renowned figure in the field of posturometry, Professor Iqra. We're incredibly fortunate to have a representative with him at Iqra University North Campus. Give a round of applause.
Hello, everybody. Can you hear me very well? Can you confirm you hear me well?
Yes, sir.
Okay, thank you so much for your invitation, and I will be very glad to be with you another time in the university. Thank you so much. I will share the presentation, and we will start the communication immediately. All right? Okay, let me share. And tell me if it's working well, the presentation there. Yes, can you see the screen? Yeah.
Yes, we can see you.
Okay, let me think something here. Let me go here and close it. Okay, I think I will share the presentation for today. You see the presentation? Yes, can you confirm that? Yeah, you see the PowerPoint?
Yes, we do.
Okay. I will start just to talk about the posturometry. You know, posturometry is a very important topic in rehabilitation. I think rehabilitation is in the field you are dealing, that is the field of rehabilitation in physiotherapy, is an important topic, and I will try to explain today shortly the main concepts of posturometry. At the end, if you like, we can do questions, and I can answer the question if you have any doubts. Okay. All right. If the presentation is okay, I will start to do the presentation. All right. The posturometry is a very important field in physical rehabilitation, and today I hope I can do a shortly concept of the whole field of rehabilitation, how we can use it in the physical rehabilitation. This guy, I think you know very well, Galileo Galilei was an Italian guy. He cannot prove the theory because he have not the instrument to prove it. And we said that all scientific way is measurable. And that's why I am very, very proud of posturometry, because with the posturometry we can transform the clinical opinion in the perfect science, because if we can measure our opinion, it will transform in science. And let me go ahead in posturometer. Posturometer is an instrument and that allow us to just measure. The instrument is just an instrument, it's nothing more. But the protocol I created for clinical posturometry is the very gold in diagnosis, because as you will see, we can make a diagnosis, we can make a plan and treatment, and mainly, and I think in physical rehabilitation that is a very, very important thing, is to follow our treatment. You know, sometimes we do treatments and we don't know how the treatment goes until the patient came back. And maybe the patient suffer because we make a mistake, a little mistake. With the posturometer, we can, and posturometry, obviously, we can see if our treatment is going well immediately. I will try to explain just a little concept of posturometry and posturometer, because this is just an instrument, as I told you, but the important thing is the concept of how it's working, and the protocol I created for this instrument. When we measure, we transform the clinical opinion in sciences. And that, I think, in my opinion, is very important. What we study, what we evaluate with posturometry, as you know very well, our body is a complex reception system. We have receptors that send to the central nervous system the environment information, and the body reacts in that particular environment. And that's why I think it's very important to measure that sensors. We can evaluate the main receptors, and we can evaluate if they are in balance between them, because the central nervous system elaborates the information that the receptors send to him. And if the receptors are not working well, the information is bad, but the central nervous system carry on reacting, but reacting very bad. We see patients like this every day in our clinic. Every medical sciences see patients with postural problems, craniofacial system problems, oculomotor system, but in my particular opinion, I think there is not a protocol, a common protocol to see the patients and to do the diagnosis. And that is what I created the MPR protocol, the myofunctional postural rehabilitation. These patients, how we do the diagnosis, obviously in our point of view. If you are a dentist, you see the teeth. If you are an optometrist, you see the eyes. If you are a physiotherapist, you see the body. But there is not an integration in the diagnosis. And that is the things we promote in our school, the integration of diagnosis, the integration of the clinical diagnosis. And with that, we will talk the same languages to treat our patients. And posturometer and posturometry and clinical posturometry is an ideal instrument to give us an objective point of view, because it's an instrument. Obviously, we need protocol to make the interpretation, and I will try to explain very shortly the protocol of clinical posturometry to show you, after I will show you the software working live, how we measure the body. But before, I want to introduce you in the concept of posturometry. This was a professor of mine many years ago in 1990 in the United States, in Seattle, and he said to me something very clever. A clinical opinion may be true or false, but it is only an opinion. When we can measure it, in that moment we transform it into science. And this is really true, Dr. Bernard Jenkinson. And posturometry and stabilometry is a new focus in diagnosis and therapeutics. I will try to explain shortly, in a shorter time, the concept of what is posturometry. Posturometry is a science that study, obviously, the static posture, right? Measure the balance between the receptors. We have main receptors, that is oculomotor system, foot support, and a big disturber of the posture, who is craniofacial system. We call that the mouth, but it's not the mouth, it's the craniofacial system. What we measure to see if they are in balance or they are altered, and if they are altered, we can observe what is creating in the tonic postural system. Tonic postural system is the main system in our body who elaborate the muscle tones, and your physio works every day with muscles. And if the tonic postural system is with alteration, your work will not be perfect. And that is important thing. We have to understand all medical sciences, not only the physical rehabilitation. All of them, we have to understand that. What's if we can talk together and I ask you that, what's look at that, guys, what they are in common, and what do you think they are in common? They are in common something very well, which is the search of the best body center possible. You understand, the best body center of the body. That is the things they are in common, and that is important to understand, because our body is every single day is searching the best body center of our body. And why? Because in that body center we use less energy. Imagine, we can use less energy in our when the body center is centrated, and that is very important, I think so. And it is very important, in the objective of the central nervous system is to find the best center of gravity, our body nearly the center of gravity, because in that position our body is centering, is using less energy. And look at that, any moment we found in the best body center. If you see here, that lady body center is always perfect, but it's adapting the body. Imagine if we have proprioception altered, our body will found in the body center, but is founding the body center wrong, and that's no good. Any moment of our life we are found in the body center. And how much lose the body center in a shift? 0. But if you see here, body center is centrated, but look at the adaptation to do the shift. All of them have back problem, back pain, sport adaptation. And that's happened with our patient. If you think about that, that's happened every single moment of our patient. And a shooter, the same. Look at the body center. It's perfect, but the adaptation of the body to do the shooter. Always, we will find a perfect body center. Maximum saving as obtained in that position, use less resources, and obviously we use less the muscular system. And that's very important, I think. When we have a problem, we take obviously pain, we adapt. If we have pain on the right, we go to the left. If we have pain on the left, we go to the right. Our body is escaping from the pain every single moment of our life automatically. And the central nervous system reacts, as I told you, automatically to find this body center, to have better work of efferences and afferences. This is automatically reaction, even if receptors are working bad, and that's very important to understand. Look at here. If one voice is out of the tone, maybe ruin the whole melody. The same if of our proprioception. if we have one receptor working bad, whole system is working very bad. And that is important thing we have to understand, because we normally do techniques for rehabilitation, but we don't take care of that. And after we don't understand why techniques relapses. Techniques relapses because we don't work in a perfect balance in our body. Ideal center of gravity is obtained only if we have perfect balance between afferences and efferences. That's another important concept. And that Dr. Hippocrates said all part of the body form a circle. That's why each part is important, be it the beginning or the end. That's why we have to see the body as a total body, integrated. That's why it's very important. Interdiscipline, this concept is important to understand. Interdiscipline or holistic treatment. Okay? You see, you listen very well, yeah? Because I listen a voice. You listen me very well, yes?
Yes.
Okay.
We can hear you.
Okay. All right. As we see there, sometimes we see the symptom of pain in another part. What is the cause? That's why we have to understand the symptoms. It's just a symptom. The cause, all times, is not there. A posturometer is an instrument of objective measurement and allow us to understand very well what is the problem. Obviously, clinical posturometry is not easy. We have to study that. To use the instrument is easy. This instrument, you connect to the USB to the PC and that's it. You can measure. But you have to learn posturometry, clinical posturometry, to make the interpretation. All right? This instrument is very easy to use. It's a little complicated. You have to study very well clinical posturometry. Okay? And I will show you the structure of the posturometer. Yeah, okay. I will show you the structure of the posturometer, how it works. This posturometer is based in the concept of Capanghi. You know, I think as a physio, you know very well Capanghi. Capanghi studied how the body weight is distributed in 3 points in our foot support. First metatarsus, fifth metatarsus, and calcaneus. And in that distribution is distributed in both foot, our body weight. The posturometer has 3 sensors in that particular areas and allows us to measure. 3 sensors, each platform allows to measure, and when we measure, we can do the interpretation. Capanghi study how is distributed the body weight, and he studied that the body weight have percent of distribution. 36% in the calcaneus, the big bone, 2.6 first metatarsus, 1.6 5 metatarsus. And if we put this point in a foot and unit the point, we make a triangle, and the bisectors of the triangle, when they meet, is the barycenter of the foot. And that measures also the posturometer, the barycenter, general barycenter, and individual barycenter of the foot. And we need to do the exams in the same position always to have a repeatable examination. That is science, you know. We have to repeat it. And the position is very simple with that posturometer, and that posturometer have lines here, and different foot numbers, different lines, and you can put always in the same line, in the same. Sorry. I listen you something talking there. You need something?
No, sorry.
Okay. In this position, the calcaneo will make the position here, and first and second metatarsus, the line are in the middle, and we can make the position always in the same place, and we can start with this protocol. The basic protocol is to show the interferences of the principal receptors: oculomotor system, craniofacial system, and podal support, the foot support. Very 3 simple exams, 30 seconds. I will show you later when I finish. I will show you the software, how it's working, and I will explain some use in clinical rehabilitation. The basic protocol is 3 exams, 10 seconds each one. The first examination is open mouth and open eyes. When that is finished, the second one is close the mouth, keep the eyes open, and the third one is mouth open and eyes closed. We measure in the first exam the posture, in the second exam the occlusion, that means the craniofacial system disturbed, and that means the craniofacial system effect into the body, and the third exam is the foot support. 3 simple exams, 30 seconds, and when you understand the interpretation, you can do a very good diagnosis. We have a graph like this. The green color of the graph is normal, the yellow is tension in the area of Kappanji, and the red color is alteration. Let's see there, yellow, green, and red. When the tip of the triangle is forward, that means more load than the normal. And when the tip of the triangle is backwards, it means less load to the normal. And it's a very graphic diagnosis. We see now the graphs as a traffic light. Red is alteration, yellow is tension, and green is normal in the area, obviously, in the area of Kappanji. And the alteration will show us the diagnosis. I show you something now. Craniofacial system sometimes can be a cause of the problem, but sometimes it's a victim of the problem. What do they mean? Sometimes craniofacial system create alteration. Sometimes the body alteration is creating problem to the craniofacial system. That is important to understand, because that is interconnection of the systems. And if you see that in that case, that particular case, 4 kilos to the, you see the left here, and here the craniofacial system is trying to do better the situation. In that case, we say this is craniofacial system is a victim of some postural alteration. In that case, the occlusion is creating the bodies with an alteration with the mouth open, and when the mouth is closed, as you see here, it's increasing it to 7. In that case, the mouth is creating a big problem to the body, to the postural system. Imagine for physio, you're doing a rehabilitation and you have a craniofacial system disturbing you. Never you can have a permanent rehabilitation. That is an important thing. We have to understand all medical sciences, the integration between the whole body. This system is creating alteration. You can never have a permanent rehabilitation. That is important to understand in physical rehabilitation. In stabilometry, we can measure some values. We can measure the oscillation of speed, the relationship of the form of the body center, the coverage of the body center, and the shape, how it is. It's very difficult for me to explain the values in 1 hour webinar, but it's important that values, because each value is indicating to us some diagnosis. This is the 3 values: variation of speed, relation form. That's very important value for you, physio, because this value is indicating in the posturometer, is indicating the muscle activity. Less value we have, we will have an hyperactivity of the muscle tone. And bigger is the value, we have hypoactivity. Imagine in your job, you want to know if your treatment, imagine some technique, you have to create relaxing in the body, and you don't know if that is creating or not. If you measure before and after, seeing that value, if that value increase, your therapy is good. And you can say to the patient, go home, it will work. But if the value is very less, you are not creating relax, you are creating hyperactivity, and you have to repeat the therapy. Imagine to have that observation immediately in the day of the therapy. That is one of the uses in physical rehabilitation. This value is the speed, indicate this value is the comfort of the body. Less is the value, the patient is under comfort. Bigger is the value, the patient is using a lot of energy and it's not good. One simple value, before and after. This one is the oscillation, the forward oscillation and the lateral oscillation. And imagine, this is the only value who is fixed. Less than the value is more oscillation forward. More than this value is more oscillation lateral. Imagine a patient who have balance problem, equilibrium problem. The oscillation will be more on lateral, and you can measure it. That is one of the things you can do. And this is the thing I told you before. This is the the muscle tone. High value, hypoactivity, less value, hyperactivity. I will show you some clinical cases, one study of some clinical cases. This patient that I will show you is a patient who have a real short leg, Imagine a patient that you can measure with a real short leg. Imagine that is very important. And when we see that, we can observe and we can do a diagnosis. Short leg, that is an anatomical problem with a side or lateral deviation and the posturometer reading. We can observe and analyze. We can analyze the diagnosis and we can analyze the treatment. And imagine, please focus in that patient. Imagine that patient that I will show you shortly, that you don't make balance in the body, how can you do the physical rehabilitation? It is impossible, believe me. And that's why most of the time treatment relieves, because we don't make balance in the body and we think the only thing we have to do is just treat the patient. Treatment is good, you need techniques to treat the patient, but the most important thing is to have the balance of the body, to allow the body to have a permanent rehabilitation. Imagine that is a clinical case that I showed you, okay? This patient have a real short leg, real short leg. And the left leg is shorter, measure it. See in the mouse, we see a lateral deviation. We here have craniofacial system together with the dysmorphisms. How you can treat that in physical rehabilitation? If you do not annulate that situation first. If you make that imbalance, your physical rehabilitation will be perfect and the job will be easy. You see here side and right lateral deviation and a little forward position. Short leg and mouse together, and that's the measure. That's the measure, the beginning. We have here the beginning of the measurement. 4 kilos to the left. Related, the lateral deviation is creating overload. And you see the proof there. Lateral deviation of the jaw is creating overload. And look at here. We lose depression in the heels and the body move forward. And we call that anteposition of the body. And look at here, this anteposition is creating overload in the first and fifth metatarsus of the left foot. This patient have abnormal posture and we measure that at the beginning. And then we do the treatment. The treatment was an insole to correct the defect, the anatomical defect of the short leg. And then we use this dispositive, this bed body equilibrium device. It's a dispositive, it's a device for all medical science. Physiotherapists in my school, osteopath, medical doctors, not just dentists, use the body equilibrium device. Just very simple to use. It's a thermoplastic device to annulate temporarily the craniofacial system problem. Here we work annulating the craniofacial system and correcting the anatomical defects. And that's the result. As you see there, insoles, bed, zero, unbalanced. With normalization of the postural overload. Body center, perfect. And the whole capanja areas in normal. In that moment, you can do a good physical rehabilitation because nothing is making interferences in your job. That is the use of posturometry and our treatment also in physical rehabilitation. Before and after, you see the both, before treatment and after the treatment. If you understand these concepts, But that is always for all medical sciences, because obviously also the dentist cannot work well in the craniofacial system if the body is not in good posture. That's why we need to work together, all medical sciences. But to work together, we have to have the same language for diagnosis and the same protocol of treatment. Also medical doctors, also osteopaths, also pedestrians, every medical science have to work in interdiscipline with the same protocol. And why the posturometer? Because that is the topic of our presentation. Why? Because we will have best results if we measure. Clinical posturometry is an optimal science for diagnosis, for planning our treatment, but the main thing is for monitoring the treatment in physical rehabilitation. You can follow your treatment when you measure. The important is to us make personalized treatments and facilitates immediate assessment of treatment effectiveness. The posturometer, in 30 seconds of measurement, you can have a comprehensive evaluation. You can check the postural balance. You can assess the muscle tone. You can confirm immediately the treatment outcomes. And the traditional approach, often we have to wait until the next session to see if the treatments are effective. With posturometer, you can see that immediately. And I think that is a very, very important thing. Immediately see if you are going well or not. And you have an immediate reporting. This is crucial for avoiding unnecessary patient suffering during the therapy progression, because you can see immediately if it's not working, you can change it. And the benefit, it allows for real-time adjustments for treatment plans based on an immediate feedback. That's all things say posturometer is a good instrument for physical rehabilitation. Okay? Why best results? Because we have essential measurements crucial for diagnosis, planning and monitoring treatments, immediate feedback. You can detect errors in real time. You can correct issues instantaneously to prevent major problems and ensure optimal patient care and effective therapy progression. That's very, very important. Very, very, very important. Thank you so much to be here. Don't go, because I will show you now the posturometer working in real time with the software. If you want, you can follow us in our medias. And you know, we have, I want to invite you to this web app. This web app is a free web app, because in that web app you can have a lot of free media or free videos. And in that web app, we are transmitting now in the web application in the other side, and we have it during the live workshop, and you will have invited, if you register for free in the NPR International School Training Center, you can be updated. And let me now go ahead to share. Let me watch. These exams were recorded, and if you click in here, this data is in the cloud. Everybody around the world can see that. We collaborate with this software, and you see here we have the 3 exams. This is the posture of the patient. This is the problem with the patient closed his mouth, and this is the foot support. Look at, in 30 seconds you can see here the overload. This posture have itself 4 kilos. The mouse, when it's closed, the jaw position is try to centrate. Imagine to centrate the position, and to centrate it here, the position. Okay, and the foot support, the third example, you see here, is creating some problem. In that general view, we see which receptor is affecting more or less. But here, let me go here to put a little bit less. Sorry, not too much. Not too much. Okay, and here we have the barycenter, the general barycenter, the three positions of the general barycenter, foot support left, foot support right, and the torsion of the body with values. And then if we want to observe what happened with each receptor, we normally do like this. We cancel the general view, and we want to know what happened with the jaw position. Then we close the foot support, and we analyze posture and craniofacial system. And here we have the main graphs. But look at here, that is very interesting. In blue is the barycenter of the body. And look at what happened with that when that patient closed its mouth. The barycenter is going back. We said, when we studied the mouth, we said this jaw is in a retro position. When it's a retro position, it's going back the barycenter and it's affecting the muscles. But also, if we, let me open a little bit more here, the zoom. Okay, here. If you go here to the values, look at here that situation. You remember the value I told you, the barycenter of the body is muscle tone, the area of the barycenter is the muscle tone. Imagine that. The value was 1000 here. When the patient closed his mouth, it's going to 300. That situation is creating a lot of hyperactivity of the muscle change. That mouse trying to center the posture, because if you go here, you can see it's trying to make center the posture. It's moving back the barycenter and is creating a lot of hyperactivity. And if we go here, we see the torsion. This mouse is not creating torsion. We know that jaw is in a retro position, but it's not under flexion. But the same we can do with the foot support. Look at here. We close in here, and then we close the mouse, we open the foot, and we put here, and here we are analyzing the foot. That's foot support, that foot support. This foot is varus, this foot is centrated. We analyze also here the proprioception of the foot support. When the barycenter of the foot support are in sobreposition like this, we say the foot support have a good proprioception. And we also analyze the longer of the barycenter. When it's good movement, there is not blocked in the foot. And we can do a lot of measurements with the posturometer. For diagnosis, for following the treatment, we can, I show you that patient we have, I think, so we have some look at here, we're testing here and the magnesium for this patient is a medicine. We're testing if it's affecting the body, it's not affecting. And we're testing the muscle tone. When the muscle tone is loose, we know that medicine or that particular thing is not good for the body. And we can measure a lot of things with this instrument. Obviously, you have to understand the posturometry. But I don't know if I answered the question you told me before regarding the mouse. I will show you another patient. Maybe we have found. Let me find one more patient here. Okay. Go in here. Okay, here is another patient. If we go here in the 3 exams, we go in and we can analyze here at the beginning, and then okay, it's coming the data. Look at here, 4 kilos to the right, and when the patient closes his mouth, is increasing the load. That is saying us this craniofacial system is disturbing the posture, is disturbing the muscle chain, and is disturbing our therapy. You can never have a good result in muscle change if you do not annihilate that system. Because any time during the night, the patient closes his mouth and doing bruxisms to liberate that situation is creating a stress to the muscle change, and your treatment slowly will release. That's why we create in our protocol. When I create the NPR protocol, the myofunctional postural rehabilitation, I create the deprogrammation of the systems. And I can show you a lot. Look at the barycenter here, the area. And I can show you a lot of patients like this. We can any patient we can see is the same. No, the 3 exams, 1, 2, 3. We can analyze. Obviously, you have to understand posturometry. Look at here, 6, 4, 6. Here is the foot support, the problem. And if you go here, see, the foot support, you can analyze what happened with the foot support. And like this, we can analyze a lot of things. We can measure treatments, we can measure diagnosis, we can analyze we can project the treatment, and we can measure insults, therapies, anything we like. Obviously, you have to understand the posturometry, clinical posturometry, that in 1 hour is very difficult to me explain the whole concept of posturometry. There is another question I here if you want. I cannot hear.
Yeah, I understand. You were saying that your mouth is David and your David and your white.
I cannot hear. I cannot hear very well. I cannot. Let me see the chat. You can write in the chat, please. The chat is better because I cannot hear with the microphone. There is a live chat here. Hello. You can write the microphone. Sorry. I cannot hear very well. It's some interferences with the microphone. You can write. If you can write, I can see, and I will answer the question.
Okay, Hello.
The microphone is not working. I don't know why. Maybe the connection of your microphone is not. It's arriving like beep 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 like this to me. If you write in the chat, I can see and I can answer the question. No problem. The microphone is not working. It's not working. I cannot listen you very well. It's making a lot of noises. No, it's not well, the microphone. No. No, microphone is not
Professor
working.
Di Rocco, can you hear me now?
A little bit better, yeah.
Okay, Professor Di Rocco, thank you so much. There was another question that one of our faculty members wanted to ask you. Can you please tell us if there is any software or if there is is any method by which we can assess the posture, or a person themselves can assess the posture?
Okay, this posturometer software allow you to measure and assess the posture, but the problem is you have to understand the clinical posturometry to understand what happened. No? When with this particular software, this is an instrument, it's a platform, it's a body platform. Then you stand up the patient over there, you do the exams, and you can analyze what happened, and you can analyze for diagnosis and also for your treatment. This software allows you also to make re-education of the receptors, is allow you to test your treatment. Imagine you are doing in physiotherapy some techniques to make the assessment of this.
I wanted to.
Yeah. Sorry
for the interruption.
Yeah.
But I just wanted to ask if there's any software that a general person, a layman person, can use to assess their posture. This is a software that is easily understandable by a person who is already working in the posturometry, and they have already got some background knowledge related to physiology and anatomy and physiology and physiotherapy.
Yeah.
They have already got that kind of knowledge. This is a software that is easily understandable by them, but this is not going to be understood by a person who is of a layman origin. They do not have any knowledge of physical therapy or those type of things. Do you know any software of such origin?
I understand the question, but I don't believe a normal patient can assess your body posture, because you cannot assess your body posture if you don't have the knowledge to do that. There is the balance, the normal balance. You do the Wi-Fi, you stand up and there and you move, but if you don't know what happened, you're doing something that is not correct. But in the clinic, with that software, we teach our patients to align themselves under our guide of exercises to realign that, but not alone. That you cannot alone assess your posture if you don't have the knowledge to do that. It is impossible. This is a game, and a posture is not a game. You know.
Yes. A layman cannot understand these things. No? They would not be.
They are not allowed. A patient.
There is another thing that I wanted to ask.
Yeah.
I don't know whether I'm on the right track to ask this question or not, but is this software available across the globe?
Yes, it is. Yes, it is. This software is included with the posturometer, you know, and with the teaching. When the people buy the posturometer, the machine, is including the software, and it's included the cursor for understand all these things. It's not just the machine. With the machine, is coming the software, is coming the subscription for the software, and this software. The particular thing is we use that in our school with our students. No. Imagine I teach all around the world. I teach in Asia, in Europe, and in America. No? And the software the data is in the cloud. And you can see the data everywhere, and you can communicate. Imagine I can send to you in Pakistan a patient that I am treating here, yeah, and you can give access to my data. You can see in the software in real time, and we can talk together with the same language, and we can see the patient even if I am here in Europe and you are in Pakistan. And this is the same in all around the world. This is the data of that software is in the cloud. You don't need nothing in the PC, just plug in the device and that's it. You can use the device and you can give access to the cloud software. And also for my students give advice to me sometimes, and I can go into their exams and I can guide them in remote for the examination until they are able to to understand all. This is a good machine. It's a good software for using, and we use that all around the world. Yeah.
Technology.
Sorry.
The miracles of technology.
It's a technology. We create that technology in our school, and
it's a miracle of that.
And we create the technology. It was not the software is a good. The hardware is a good technology. But the main instrument is the software, because with the software you can analyze a lot of things. The hardware is an instrument for measure, but with the software and the protocol I create for the software, it's very good for diagnosis and for following the treatment. That is the thing we use in our school all around the world, in different countries. No?